I want to thank you all for joining me today. I know that we are dealing with a crisis right now. As a father of two young boys, actually a 3 and a 1-year-old, so boys who are just recently getting past needing to nurse or have formula. I know what parents are going through. I know the stresses that they must feel when they feel they can't get the food that their babies need, and I know how heartbreaking that must be. Inflation, the supply chain crisis, and now this. I know that this has been a difficult time for families. This is on top of coming out of 2 very difficult years of COVID, and that's why I think it's so important that I hear from you all. And I do want to go through some of what we're trying to do in Congress to address this crisis, what the White House is doing. I supported the bipartisan passage of 2 pieces of legislation to help us address the formula crisis. The Infant Formula Supplemental Appropriations Act, which provided $28 million in emergency funding to give the FDA the resources it needs to address the infant formula shortage. I hope the Senate will take that up and pass it quickly. And the Access to Baby Formula Act, which provides flexibility so low-income families can purchase safe formula with their WIC benefits during extenuating circumstances, such as supply chain disruptions like this. The White House has taken a whole of government approach to this crisis, including invoking the Defense Production Act, which the president has done twice already to help secure the materials needed to speed up production, using military aircraft to import formula. And this is an operation called Operation Fly Formula that has already resulted in 2 huge shipments of formula from Europe. And so far, those shipments have resulted in the equivalent of about 1.5 million 8-ounce bottles arriving in the US, and urging the Federal Trade Commission and state attorneys general to crack down on price gouging. I led an effort urging our Texas Attorney General to use the full power of his office to crack down on price gouging in Texas. And I hope that attorneys general across the country will be doing the same. And finally, working with private companies to try and increase production and supply. And I know there are some agreements in place to try and do that. In fact, the FDA is in agreement with Abbott to get their Michigan plant back online and to take steps to make sure the kind of safety violation they had and the disruption that it caused is less likely to happen in the future. Even so, we know it's going to take 2 weeks for the Abbott plant in Michigan, which was closed for safety issues, to return to full capacity, and several weeks after that for their formula to end up on the shelves. And that's why we have to continue to do all we can to ensure that parents can get the formula that they need, and that's why today's conversation is so important. So thank you all again for joining me today, and I look forward to this conversation. And so if I could just have y'all maybe introduce yourselves very quickly, and then I can ask you some questions. I'll begin with you, Jessica.
Hi, everybody. I'm Jessica Morse. I am the Director of Newborn Services over at Parkland and Clements University Hospital.
Great. Thanks so much. Melody?
I'm Melody Edwards. I am the National Outreach Manager for Nurse Family Partnership and Child First.
Great. Jacqueline, good to see you again.
Yes, my name is Jacqueline Green, and I'm a community health worker, and I am a Nurse Family Partnership alumni.
Okay. And I don't know if Angela's with us here, but I think, Jacqueline, I'll begin with you and just ask you, reflecting on your experience yourself as a mother. At what point did you use formula for your child, and what barriers do you think a shortage like this would have caused for you and your family, or for folks that you're working with now?
Yes, sir. So, well, thank you so much for this opportunity to share my story. So, of course, yes, I'm a community health worker, and I found out about Nurse Family Partnership at the WIC office. When my mother-in-law passed away mid-pregnancy, I knew I needed guidance to be a great mom like she was. So when my son was born in October of 2019, I had decided then and there to breastfeed my son exclusively. Once I got home, my milk didn't arrive until 3 days later. My personal nurse with Nurse Family Partnership advised me to drink plenty of water, eat healthy, to rest, and to take some postnatal vitamins to keep up my milk supply. But even with all the advice and support, I was still not able to satiate my son. So I decided to supplement with a non-dairy formula called Nutrimogen. Now, this formula was not easy to find in stores. And on top of that, the WIC benefits did not cover any of the costs for any non-dairy formula. So luckily, I was approved for SNAP benefits, and I was able to use it to purchase this formula. But I could only find the formula at Walgreens, and the price was $50 a can. I made it work as best as I could as a stay-at-home mom, grieving the loss of my mother-in-law. Being that I had to struggle just to find and purchase my son's formula, I can only imagine the trauma that can be caused with not being able to feed my son. In the community, as a community health worker, I have seen the downfall of events happen due to lack of resources. This includes food deserts, access to transportation, and healthcare needs and education. If there was a shortage of formula for my son, the barriers that I would run into would be a lack of ability to feed my son properly, an inability to drive a long distance to find formula due to my husband being a bilateral amputee and unable to drive. If formula was found, it would be an increased cost of the formula and a decrease in the amount of food for my family due to using all of my SNAP benefits to pay for the increase of the cost of the formula, and a fear of my son becoming sick due to malnutrition, and even an increased risk of postpartum depression. Thank you.
Well, thank you for sharing that. Melody, I just want to know if you could just share with us how you think this shortage is affecting mothers that you're working with here locally, and whether there are any other issues, in addition to the shortage, such as food deserts or lack of leave, that maybe have made the effects of this even worse.
Absolutely. We have received reports. So I live in North Texas. I'm in Tarrant County, work closely with Tarrant and Dallas County Nurse Family Partnerships. We've received reports that there have been Nurse Family Partnership clients who have received formula that was flour in the can, not baby formula, flour. So we know that the education that Nurse Family Partnership is providing is extremely important. They give them tips. Number one, not to stretch formula by adding water, which seems to be the number one thing that when they start panicking that they're not going to be able to get the formula, they want to add water, which is very serious because to them it's stretching it out. But to those that know, it can cause the baby's electrolytes to become out of balance and even have seizures. And as a mom who raised a son with a seizure disorder, on several levels, just what we experienced as a family, what he went through as someone with seizure disorders, and the fact that if I wouldn't have had insurance provided through my organization that I worked for, his seizure medicine would have been $900 a month. Now, his story, he has overcome that seizure disorder. He still is on the medication. He just won a Grammy Award. He's a very successful music producer now, but we lived through a very tough time. And if I was a single mom, I don't know how I would have paid for the $900 a month for that. So that is near and dear to my heart. And when I found that out, that moms are adding the water, it's difficult for me to hear. A lot of moms don't know it's okay to switch brands. They think they have to stick with that brand, or they want to make their own homemade formula. We've had a mom from our Wings Nurse Family Partnership in Dallas that had a baby, 8-month-old baby with an ear infection. She drove all over Dallas one morning with this baby crying, sick, hurting. She ended up having to call around. She ended up having to go to Corsicana to get her baby formula. So we do appreciate the actions and the initiatives taken by Congress and the White House to address this shortage. We deeply appreciate that. And in order for us to continue with what we're doing to support the families, we need you guys to reauthorize the Maternal Infant Early Childhood Home Visiting Program, short for MICV, without action. our funding is going to end this year on September 30th. So with tech, that's nationally. As far as Texas goes, we've got these rising birth rates here in Texas, and we're asking for this additional funding for McVie to be able to serve more Texas families. I really, really appreciate you having me here again on more than one part. This is near and dear to my heart. I have a pregnant daughter-in-law who has been through more trauma than you can imagine. She went through her parents' divorce. She had an abusive marriage. She divorced him. She's married to my son. Her brother was murdered. It's still unsolved. She had another brother that died of an overdose. She got COVID in 2020 and miscarried my grandbaby. Then in 2021, last year, she gave birth to my grandson on July 31st, and he passed away that same day. Right now, she's pregnant again with a girl. We're very excited. Her mom has ALS. They've given her 2 months to live. So this is a young woman in her 30s that's had tremendous trauma that she's experienced. Right now, her focus should be on being excited about the baby. And her concern is, what if I'm not able to breastfeed? What if I can't find formula? The last thing she needs right now, after everything she's experienced, is to worry about formula. She should be looking forward to this new season in her life and taking care of her mother in this later season in her life. So I deeply appreciate you guys allowing me to be here. It means a lot to me to be able to speak to you. I appreciate it and hope that you can remember us and the McVie funding that we rely heavily upon.
Absolutely. Thank you for sharing that. And, this is certainly not about me, but having a 1-year-old right now who has an ear infection and that drove him to the doctor yesterday and daycare today while crying. I can't imagine, what that, mom you were talking about. Well, I can't imagine, how awful that drive must have been, going all around North Texas trying to find, formula. And I mean, y'all know when you have kids, you'll do anything for them. But with babies, there's a certain level of helplessness that you feel when you can't, make them feel better. And it's heartbreaking. It really is. And, so thank you for that. And Dr. Morris, I want to turn to you. I'm sorry for, mentioning, what we're dealing with here in our family, but for families that are struggling to find formula for their children right now, what's the most important health and safety information that they need to know? Melody mentioned a little bit about the dangers of diluting the formula, but maybe if you could also, mention homemade formula or some of the other alternatives that you've seen and how those could potentially be a problem.
Yeah, absolutely. So diluting formula is absolutely an extremely dangerous thing to do. Babies become hyponatremic, and they do develop seizures. That not only that, it decreases the caloric density in the formula, so they become malnourished, which then leads to problems being able for their immune system to be able to fight off infections. So then they get more infections, and it's just this downward spiral that these babies have. With homemade formulas, the real dangers of those are, I've seen a lot of formulas floating around with evaporated milk and Karo syrup. However, they don't, formulas are really heavily regulated for a reason. They're really designed to supplement everything that an infant needs. They balance the vitamins, they balance the nutrients, the calories, the amount of protein that babies' kidneys can handle to process through. And so when you get into these homemade formulas, they don't have enough calcium, they don't have enough iron specifically. And so these babies then don't have the balance of nutrients that they need to be able to grow and thrive. There's a lot of goat's milk formula that's been floating around, recipes that have been floating around. Well, goat's milk has an increased protein content than cow's milk does. So if you use goat's milk, well, then they say, well, we'll just dilute it. But how much do you dilute it to? And if you dilute it too much, then you run into the same problem of the electrolyte imbalance that you can create by diluting formula. Plus, it doesn't have enough iron, so you've got to add iron to it and other vitamins or calcium and all of that. But how much vitamins are families going to add to it? Do they know? And you can't just add, however much vitamins you want. There are vitamins that are what we call fat soluble vitamins that our body doesn't clear. And so those vitamins then can build up to toxic levels in a baby. So not only that, what about the preparation of the formula? Like if you're making homemade formulas, bacteria can be introduced very easily, as we already know, which is what led to our formula shortage with bacteria being introduced at the plant. We worry about botulism, E. coli, salmonella, all of those things can get into that formula that you're making for your baby at home. And so again, really want to stress that homemade formulas are not the way to go for our patients and our babies here in the United States.
Yeah. And if someone's looking for formula, is it a good idea for them to give their pediatricians a call?
Absolutely. Again, what was stressed before was that, you don't have to stay on a specific formula brand. So I talk to my patients all the time and my patients' families, and I tell them it's okay if you want to use Enfamil, Similac, Good Gerber, Good Start, the Target brand, the Walmart brand, Parents' Choice, any one of those, as long as it's specifically for infants and it's a basic infant formula, that is fine. Any of those brands are appropriate for your baby. The problem comes when we have these infants that do require specialized formula like Nutramigen or some of the others. Those are the ones that those babies really do need that specific formula. There are sometimes we can switch brands for those formula that as long as it's a similar type. And so those families, I would really encourage you to reach out to your pediatrician saying, I can't find my specific brand. What is an alternative brand that I can also be on the lookout for my baby?
Yeah. Jacqueline, you were mentioning, the WIC program. Can you just say a little more about how that wasn't working for you in your situation? Do you have any thoughts on how we can make that work better?
Well, I guess when parents come into the WIC office, they just need to have the information provided so they can go ahead and get the process started. And they should also know exactly what benefits are provided when they do get the WIC benefits. I think a lot of parents don't really know what benefit WIC can help with, and also kind of know what the limitations are. Because when I first went into the WIC office, truth be told, I didn't have Medicaid at the time. And so they kind of turned me away. But luckily there was a card on their table that had Nursing Family Partnership and Wings Dallas on there. And so I was able to call Nurse Family Partnership, and a nurse came out and helped me through my whole pregnancy until my son was 2 years old. And they actually helped me to get all of the benefits alongside getting the WIC benefits started, so I could successfully go through my whole pregnancy fully supported. And so I think that as soon as they get pregnant, they need to be informed of all of the benefits and just kind of guided through the journey, because it gets kind of confusing when you have to start handing cards and giving information. And right at this point right now, I'm trying to make sure that I can carry my baby full term instead of you asking me a whole bunch of questions. So
yeah,
things like that.
Yeah. Well, I also just have to say, for anybody who runs into issues with kind of complying with the requirements of these programs, you can always give your member of Congress a call. You can give my office a call, and we're happy to try and help and do everything we can. I know Parkland and UT Southwestern are also there to help. I know Nurse Family Partnership is there. Melody, did you have anything you wanted to add to that, or?
Just that we support extending the full benefit Medicaid and CHIP postpartum coverage to 1 year after the end of the pregnancy.
Yeah.
To help with the continuity of care for postpartum women, resulting in more equitable access to service. And just wanted to say thank you for having Jacqueline and I here today.
Dr. Morris, is there anything around the storage of formula that folks need to know? Is there
Yeah, so for the most part, the powder is pretty easy to store. Just keep it nice at room temperature. Once formula is made, so once you mix the formula, it's usually good for about 24 hours in the refrigerator, and then good for about an hour after if you leave it out and the baby drinks from that bottle.
Yeah. Well, I think this has been a really important discussion. I want to say that I think the state of Texas should expand Medicaid, as Melody was mentioning, cover over 1 million Texans and help us, bring more folks into some of these important programs. But we're going to do everything we can to deal with the crisis at hand. We have to say that we've seen a consolidation of the manufacturers of this formula. We have a very few kind of, companies that are producing this. So when you have a major plant shut down because of some fatalities that were caused, as Dr. Morse was mentioning, by safety issues in that factory, then we can have an immediate hit to our supply. And as we've seen with the pandemic, our supply chains have been severely kind of curtailed. And so now we're having to look around the world, see where we can find formula and bring it in. I want to thank the Biden administration for moving quickly and using sort of the logistical power of our Defense Department to fly in this formula, and with the FDA working with Abbott to get their manufacturing back online. But in the meantime, while we're waiting for some of these things to really filter into our community, I just want to say that my office is here to help. You can give us a call at any time at 972-972-7949. We're happy to help. You can go to allred.house.gov, find our address, our email, phone number, any way that you want to reach out to us. I know Dr. Morris and Melody and Jacqueline, that y'all are here to help as well, and we'll try and do everything we can to support any families that are going through this right now. And I just want to say that this is something that as I said, with a 3 and 1 year old, I feel it personally, but also just as somebody who was raised by a single mother, I just can't imagine some of the concerns that our families are dealing with right now. And we're going to do everything we possibly can to address this crisis here in North Texas and across the country. So, thank you all for your expertise. Thank you for sharing your stories. Thank you for helping us discuss this a little bit. And we'll be putting out more materials and trying to provide more information to try and help folks manage this crisis. So thanks again.
So before everybody goes, I will say the AAP, the American Academy of Pediatrics, did come out with new guidelines for babies that are 6 months and older, saying that during this crisis, they can switch to whole milk for their infants. And so as long as the baby has a really nice balanced diet, they're eating iron foods, they can use whole milk instead of formula. However, they shouldn't exceed 24 ounces of whole milk per day, as that can lead to very significant iron deficiency anemia. So making sure the baby has a well-balanced diet with iron-rich foods and using whole milk.
That's great. Thank you, Dr. Morris. Really appreciate that.
So that should help some of that, for some of those families.
Yeah, that's great. Thank you, Dr. Morris. We'll certainly try and spread that around as well. Okay, thanks so much.
Thank you all. Have a great day.
Thank you.
Thank you.